I'm Jill De Bene. I'm the CEO of SiteKit Applications Limited. At SiteKit Applications, we believe that the person is the most important person in their journey to health and well-being. And we believe that they need to have the information and knowledge to support them on that journey and to make the right decisions. Now that's a big ask, and we've started in the obvious area of newborns to 5-year-olds. So if you have a child in England, as a mum, you are given traditionally a paper red book. It's called the red book because it's got a red plastic cover. And in that book, it's supposed to tell you as a mother what's going to happen to you and your child, and what the important immunisations and physical examinations that the child should have to make sure they have a good chance for a healthy start. It records heights and weights and other information about the child's development. Now, we've been working with the NHS for a number of years because, quite frankly, most mums who've had that paper red book, well, I worked in the health service a long time ago and I managed community services across Kent, and more often than not you would be given back a pristine copy of the paper red book because the mums just didn't feel that it was their place to write in it. They were a bit in awe of probably the health visitors and midwives, and they felt they were just carrying the record to give to the midwife and the health visitor in case they wanted to write anything in it, and if they didn't, well, fine, they gave it back when their child went to school. So we've been working to make that digital because, well, quite frankly, the mums of today are used to a digital experience. And we've had comments from parents who've said, why do I go and register my child, or the fact that I'm having a child, and then get loads of paper? And sometimes that paper is additional paper to the red book, and it's in poor condition, it's out of date, it's scribbled on, it's updated in pencil or pen, and it's really poor quality, and it's not in any context. So we've developed the eRedBook. Now the eRedBook, as I've said already, relates to the Healthy Children's Programme, so it has the right information in the right place about what the child should have as they start their life. The content is worked very much with the NHS, so it's all the advice from NHS Central, and we've also worked with other partners such as UNICEF and NCT to have the valuable information that's in there for mums in a way that is easy for them to access. It's clinically safe, and it's been endorsed by the health visitors and the paediatrician societies and professional bodies that we've been working with. So the features of the red book, and mums can have this either on their laptop, they can access it there, or mostly people do it on the phone. We very much wanted to produce a longitudinal record, which was more in line with, I suppose, Facebook, so that the stuff was relevant at the time. So it's no good telling a mum that at 19 weeks their baby should be doing this, that and the other when the baby is 9 weeks old. That makes no sense for a mother. 10 weeks in the baby's life is a long time, and they're busy, they're exhausted, it's their first baby, they're finding it hard to cope with, or they've already got other children and it's difficult managing and juggling everything. They may have to go back to work. They haven't got the brain space to think about context and what is relevant when. But with the digital eRedBook, the eRedBook does the work for them. So the longitudinal record, as you see here, tells you what's happening when, and points out to the mother that the child is about to be invited to go and see the health visitor and what that visit is all about. So when the mother goes, she's less anxious, she knows what's going to happen. The professional that she's seeing has a much easier interaction because the mother has arrived prepared and knowing what's going on. The eRedBook provides information, so we flow data from other systems where immunisation is recorded, for instance, and we flow that into the eRedBook so the mother has a record of what's happened for her child. The mother is also able to make notes and upload photos, and the professionals who are working with mothers who've got eRedBook in London are feeding back to us that that is really proving to be quite useful, and mothers are much more interactive with the digital eRedBook, the eRedBook, because they can, it's just how they work, it's how life is now, and they can put a photo of the child, you know, playing on the computer or whatever, and, you know, make a comment, which is a much better record. The other features include being able to record contacts, being able to record height and weight. Height and weight is critical in the early years, as it is for most of us, most of our life, because it shows whether they're developing in the normal range that would be expected. So the mother can actually record the weight or the height in the eRedBook. It's very easy. They don't have to try and think where that weight goes as a dot on a diagram. They just put the figures in and it's automatically done for them. And the difference is shown by a different symbol. So if a professional records the weight and that is fed into the system, it's a square, or if the mother does it, it's a circle. So it's very clearly seen who's recorded the weight. The developmental first has been one of the sort of aha moments, if you like, of the eRedBook, because in the paper version there was a list of things that the parents could record. They very rarely did. But in the digital, obviously you take advantage of what you can do with digital over and above paper. So with digital you can upload a photo of the child holding their head up for the first time, or taking their first steps, or looking, or speaking, and that automatically records when it's done. And we're getting feedback from therapists in particular who say that that is proving to be very, very insightful. So if there's a problem that develops later on, the therapist will ask the mother to share what they've put on the eRedBook, and by looking at the developmental first photos, the therapist is able to add that to their whole experience and interaction with the child and the mother, and possibly help their diagnosis. Professor Lingham said that actually the most important observations of a child and their development come from the parents, and that professionals need to be involving parents in the care and development of their child and taking note of what the parents are actually saying about their child's development. An eRedBook as a personal held record that the mother holds for the child is a very important step forward to make that happen. I've spoken a lot about the mum, and obviously the eRedBook is linked to the mum, but it is also available for the father as well, so they can have access to it. And again, we've had feedback from parents that where the father is away, in some cases some of our parents are in the armed forces, so they're obviously away overseas, but also a lot of parents work away during the week, but they're able to share in those development first moments that they just couldn't share in another way. So I think that whole involvement. Also, some of the feedback we've had from the armed forces, from the health visitors who work with the armed forces, is that they're finding that the fathers relate better to a digital record than they ever did to the paper eRedBook, because again, they're young men and they think and they act digitally, and it's a natural way for them to be. But it also, the circle of care allows for the professional to have access if the mother allows it, so that they can see and enter some information into the eRedBook. You can allow grandparents to have it as well. And another mother described it as her family management system, because if she's tied up in meetings and can't take her young child to the meeting with a health visitor or the weighing clinic, her mother-in-law can, and she can have access to the eRedBook just the same as the mother would, on a read-only basis or on a read and write, depending on what the mother chooses. So with the eRedBook, we have also worked very closely with the NHS, and we are in England. There is the NHS login, which is a way citizens are identified and can interact with the health services. So we have made sure that we are part of that NHS. In fact, we're the first company to use NHS login for a personal held record. And we're also the first company that has national events management as a personal held record. We're very keen and actually stringent on standards, so that data that is flown, we use fire messaging as our standard approach to passing information from other systems into the eRedBook, and it's on a push and publish type basis. There's a lot beneath the surface with the eRedBook, so we have a number of things to pull together, so we have to make sure it's engaging and that the mums want to use it and it's meaningful as an app on your phone. The mums just download it from the App Store, and they can get vouched by being part of the NHS login. So the actual process of getting eRedBook as a mum is not too arduous, and it then easily links the child to the mum when the child is born. But below the surface, there's a whole network and platform of interactions that we're develop and work with other suppliers to make sure that the standards are achieved. We have such ambition for our personal held record because we do strongly believe that it's the way forward. We strongly believe that what happens to you in your early years is critical for how you live the rest of your life and can impact, and things can come out later on in life, both health and physically and mentally, that have come through that. So we want to take this whole personal health record further forward. We're actively looking at a product for the children in schools, and in fact a lot of the eRedBook already takes the child up to 19, but we want to look at a record for the 5 to 13-year-olds, which picks up more of the healthy eating, healthy living type interactions, and supports the schools and the education, as well as obviously the parents and child. We want to, in our plans, we're looking at the 16 to 20 plus application as well, because again we feel that that's when the mental health issues may come through, knowing what's happened to you, taking responsibility for your health and well-being, knowing what immunisations you've had is critical, and it starts to put a good emphasis for the individual if they are then taking responsibility. So in my dream, I would love it if every child, when they were at school, had an eRedBook that they had on their own phone, so that they were beginning to take responsibility, that they had signed up to NHS login, and that they had a life book that accompanied them throughout life. Sometimes it won't be important to them, but other times it will be bringing information that's key to help them live a long and healthy life.